Let me just start with a few things here. First of all, I want to continue to encourage unvaccinated Georgians to talk to their medical professionals or those that they trust and consider doing so. This safe, effective vaccine reduces the likelihood you will get infected with COVID-19, but more importantly, it drastically will reduce the chances of you ending up in a hospital bed or losing your life. In fact, during my call with the Metro Atlanta Hospital CEOs last week, they reiterated on the call that well over 90% of all Georgians currently hospitalized with COVID-19 are unvaccinated. That's why I've written again to the FDA to encourage them to grant full approval to the vaccines in order to address hesitancy among many Georgians who haven't gotten their first shot yet. 168 million Americans have already been fully vaccinated, and thankfully our numbers continue to rise here in Georgia. But one of the things that we continue to hear from those who haven't been vaccinated is the EUA status of the vaccines. I'm hoping that the FDA will act soon and we can continue the great efforts that state, local, and nonprofit and private sector leaders have made to get more shots and arms. As I've mentioned last week, I held another routine call with CEOs from the Metro Atlanta area where they provided a status update on their ongoing efforts to fight COVID-19, but also care for other pressing health care needs of the people in their communities. I'll also add that my office has been in contact with many of the rural hospital leadership teams over the weekend and yesterday, or prior to the weekend, into last week, and also today through communities throughout our state. Virtually every hospital's most pressing issue is a lack of qualified staff to treat the patients coming through their doors. Nurses, respiratory therapists, ICU personnel, just to name a few. Through October of this year, the state, coordinated through the Department of Community Health, has already committed $500 million to provide 1,300 staff on an ongoing basis to 68 hospitals across our state. To expand those efforts, I'm announcing today that Commissioner Noggle and her team will increase the total number of state-supported hospital staff from 1,300 to 2,800, more than doubling our staffing assistance to date. This would amount to an additional $125 million of investment in state-supported staffing of hospital systems in both metro and rural areas through the first week of December. Specifically, 170 of these new staff will go directly to rural hospitals. Commissioner Noggle and her team will have also identified 450 beds in 9 regional coordinating hospitals that will soon be available to treat patients statewide thanks to this additional staff. As we move forward, my team and I will continue to monitor the situation in our hospitals to ensure that Georgians who need access to care can receive it. Also, to encourage more state employees to get vaccinated, today I'm also announcing that state offices will be closed Friday, September 3rd, in advance of Labor Day weekend. I'm asking all state employees who have not yet gotten their shot to consider scheduling it on or before Friday, September the 3rd. For those of you that have been vaccinated or got their shot before September 3rd, please take this day off as a thank you for all the work that you have done and for stepping up to help protect yourselves and protect others from you during this pandemic, and enjoy this time with your friends and family. We certainly are appreciative of all that our state employees have done over the last year and a half, going on 2 years now, working through a global pandemic and keeping our state running. Finally, today I want to reiterate that Georgia will remain open for business. We will not shut down. We will not prevent families from earning a paycheck. Georgians know the risk of this virus, and they know we have the tools at our disposal to prevent serious illness, hospitalization, and death. The most important thing for Georgians to do at this point, if you're not vaccinated, is to please talk to your doctor or medical professional or someone that you trust that perhaps has been vaccinated and make a good health care decision for you and your family. As you all know, our 3 daughters have been vaccinated, and Marty and I have as well as our parents. As I've said for the last year and a half, I'm again asking Georgians to be part of the solution to this virus. Again, thank you all for being here, and I'll turn it over to Dr. Toomey, and then we'll take some of your questions. Thank you. Dr. Toomey.
Thank you very much. I just had a couple of remarks I wanted to make about the current increase in cases, which are about 90% Delta variant. Again, this variant is much more transmissible. It goes very quickly from person to person. It causes you to become infected much more quickly within a matter of days rather than a week or longer. And so, not surprisingly, it's making a beeline for unvaccinated individuals. The good news is that vaccines do work. They are protecting people from consequences of what is a potentially more dangerous virus, and it's really good to see that that is happening. In the hospitals, though, as the governor was saying, we are seeing increases, and significantly, we're seeing increases among younger people than we saw before. And so the highest rates yet that we've ever had among individuals 30, 40 years old, higher rates in 50-year-olds. And so these are younger people than were hospitalized before, and I think that's, again, a reflection of the fact of the most vaccinated population are older adults here in Georgia, and that we need to talk to our family and friends about the importance of vaccination. We have not continued to push to offer vaccines everywhere we can. I fully believe that it isn't going to a vaccination site that's going to motivate somebody, but having family, friends, your church members, having the opportunity to be vaccinated at the time you're doing other activities like grocery shopping or going to a farmer's market is when people will make that decision ultimately. And also engaging with primary care providers around the state, and we are working with them to ensure that they are able to offer vaccinations in their offices, and most importantly, counsel about the vaccine when their patients come in to talk to them and ask them questions. We actually had several events this weekend which were very, very productive. In DeKalb County, there were some incentive vaccinations there, along with sports stars, and over 1,100 vaccines were given out at that special event. In Savannah, there were special events around the farmers market and an arts festival, Say Yes to the Vaccine, which is a partnership that we're doing throughout the state with Home Depot. It was in Savannah this weekend, we'll be in Athens soon, and at the aquarium here in Atlanta. And people walked up, talked about the vaccine, walked away, walked back, and decided afterwards to get vaccinated. And they said it was easy, and that was one of the barriers that they had said was there before, that it wasn't easy. I didn't want to make an appointment. I didn't want to take time out of my day. I was there shopping anyway, and so you made it easy for me. I'm going to get vaccinated, and we're going to continue to do that throughout the state, even as we roll out increased testing. And the testing is a really important part of where we are now. As we're seeing increasing cases, we're also seeing an increasing proportion of percent positivity rates among the tests we're doing. It's almost 17%. So knowing that, we know we need to be doing more testing. We in public health are ramping up the testing associated with our health departments. We also are going to be offering to the hospitals to be co-located with them to offer testing as well, to ensure that they don't get overwhelmed with people coming in to be tested or with mild symptoms that would be better served just getting tested by public health. We want to do everything we can to keep people away from emergency rooms that are overwhelmed right now, if they don't need to be at the emergency room, not only for treatment of COVID, but for many other things that happen every day in the emergency room, from heart attack, stroke, or trauma. So we're working with the hospitals and want to reassure everyone, because I know that some areas have not had easy access to testing. In the coming week, we are making that easier throughout the state. And I think that's all I have to say, other than that we will be offering the vaccine throughout the state, as will other providers, to those who are severely immunocompromised. That was the only expansion that the FDA, CDC, and their advisory group made that last weekend, actually. So ACIP said that it's just those who are severely immunocompromised, either because of medication, because of severe HIV disease, because of cancer treatment or organ transplant. But these are not booster doses. These are not doses to help others who may have chronic health conditions. This is a very limited expansion, an additional dose for those who may not be able to mount an immune response. We are anticipating that by the fall there will be more information about booster doses, and we'll keep you informed of that when that happens. So that's all I have for now. Thank you very much.